today. We do want to, though, look under the hood of the big, beautiful bill as it is pending in the Senate with the July 4th deadline fast approaching for passage, though the White House and Senate Majority Leader John Thune are confident they can get that done before the July 4th deadline here. But we want to talk specifically about some of these Medicaid core tenets in the legislation that were taken out, breaking some rules, according to the Senate parliamentarian. Well, why? Let's talk to Tom Savidge, our friend there at the American Institute for Economic Research. Tom, good to see you here. So I want to start with this. Jake Sherman there at Punchbowl, he has this. He says this is massive news. The Senate parliamentarian has struck a whole bunch of critical health provisions from the reconciliation bill, including the provider tax framework. If you could, and I know this is somewhat arcane here, when talking about Medicaid and Medicare, what is the provider tax framework?
So it starts out with Medicaid, and Medicaid is uniquely funded. Medicaid is funded by a joint match of federal and state dollars. And so you have traditional Medicaid, which is what the program was originally designed as. And that matching rate for the federal government ranges anywhere between 50 to 70%. Now, when you had the Affordable Care Act come in, it created the expansion group, which were a number of people who were previously ineligible to enroll in Medicaid because their incomes were higher. But the federal government reimburses states at higher rates. And so right now, that reimbursement rate is 90% federal funding, 10% state funding. And when it was originally passed, it said the federal government would cover 100% of the expansion group. And so states rushed to expand Medicaid and prioritize those folks in the expansion group to the detriment of those in traditional Medicaid, the poor, single mothers, things like that. And so when you're talking about provider taxes, states want to maximize that federal matching, those federal match dollars as much as possible. Okay. So what the provider tax essentially allows is that the state will tax a care group, a healthcare provider, and then have those taxes count towards Medicaid spending, and thereby inflating the Medicaid spending and increasing the amount of federal money that's coming into the state. And so it's kind of a money laundering scheme.
Oh, wow. I want to put up the Senate parliamentarian. Her name is Elizabeth McDonough. You see her there. She's been the parliamentarian in the Senate since 2012. And I think a lot of people are asking themselves, some of these kind of outside bystanders to this entire process, what empowers the parliamentarian to strike pieces of bill text that don't corroborate or correspond to some type of number? And we can get into this. Obviously, she's unelected. Some Senate Republicans are calling for her firing over this. And let's put this tweet back up from Jake Sherman. These are some of the core tenets with regard to the Medicaid question that she has struck. You see there the immigrant Medicaid eligibility, also the expansion of FMAP for certain states, providing payments for health care furnished to certain individuals, spread pricing in Medicaid, prohibiting federal Medicaid and the CHIP funding for gender-affirming care, and others here. The Senate parliamentarian saying you can't add those in. Why not, Tom?
So essentially, the one big beautiful bill is what we call a reconciliation bill. And that is a bill that allows Congress to push budget items through an expedited process. So not through the normal budget process, through an expedited process. And members of Congress have been huge fans of this. We've heard time and again, it seems like it happens almost every year, where they are running into the 11th hour to pass something, and it's one of these reconciliation bills, right, where they are doing things in the 11th hour. But of course, our legal system, you have to think of it as processes, not outcomes. It's focused on processes. Given that you have these expedited bills, there are guardrails of what you can and can't do, and that was the basis for the parliamentarian striking down those certain provisions, which of course it's a disappointment to see, because closing that provider tax loophole would really help Medicaid spending and ensure that it doesn't get, the folks that really need it don't get crowded out, and that these systems don't end up bankrupting not just the federal government, but the 50 state governments as well.
Okay.
And so really it's kind of at the fault of Congress trying to rush through things through at the 11th hour. Think of a student trying to get that paper submitted by 11:59 p.m. Whereas if they had gone through the normal budget processes, they would have had a lot more leeway there. But I was reading that if members of the Senate rewrite the provisions to fit within those guardrails of the parliamentarian, especially the provider tax provisions, it can go through.
Oh. So I have to ask this. There's been a lot of back and forth. I've been asking so many lawmakers on here, reporters who cover Capitol Hill who come on here, whether or not Medicare and Medicaid are on the chopping block. After what you have seen, after this has been pending in the Senate for so long, what's your assessment? Is Medicaid going to be cut in the big, beautiful bill or not?
Well, whether it happens this bill or not, it is going to happen sooner rather than later. And it's going to happen before Medicare. Think of President Trump's promises in the campaign trail. He's not going to touch Social Security. He's not going to touch Medicare. Now, as I mentioned before, Medicaid has that unique funding system, state and federal government contributing. The federal government contributes a certain matching rate. All the federal government has to do is adjust that matching rate and say to the states, okay, you guys have to pick up a larger portion of the tab. But then the onus is on states they either have to raise taxes, take on more debt, or cut funding from other state spending programs to cover that gap. But it gives the folks in Washington, those politicians, some plausible deniability. They can say, listen, we just told you you guys had to foot a little bit more of the bill. We never said you had to make cuts to anything else. And it allows them to kind of wash their hands of the backlash from those spending cuts. So if something is going to be targeted, it's definitely going to be Medicaid. I hope to see especially that provider tax provision get reworked and make it into the final version of the bill, because that would really help the solvency of the Medicaid program.
Yeah, we did hear from Majority Leader John Thune today. He admitted that the parliamentarian rulings may push back the vote. We'll have to wait and see on that. He said, though, he's prepared, quote, these are speed bumps along the way. We anticipated those, and so we have contingency plans. He says, obviously, you have to adjust the timing and schedule a little bit, but we're moving forward. Tom, while we have you, because this is Medicaid related here, I want to put up this tweet from the Associated Press, show you some just file footage as well of the Supreme Court. Major ruling today there in Washington. I want to read it here from the Associated Press. They report this, that states can block the country's biggest abortion provider, Planned Parenthood, from receiving Medicaid money for health services such as contraception and cancer screenings without facing lawsuits from patients. That was the gist of this ruling today. This was a 6-3 opinion along ideological lines. Justice Neil Gorsuch wrote the opinion. He joined and was joined by the rest of the court's conservatives. They say this was not directly about abortion, but it comes as Republicans back a wider push across the country to defund the organization. It closes off Planned Parenthood's primary court path to keeping Medicaid funding in place. And the Associated Press describes that key path as patient lawsuits. So I have to ask, so the gist of this, Tom, the ruling is that now, after this ruling, patients cannot sue. You do not have a right to choose your own provider. Is that the crux of it?
So it's a complicated situation where our legal system, again, you have to think of that foundational idea. When the founders were drafting the Constitution, our system is about processes, not outcomes. And so they were looking at the process here of Medicaid funding. And specifically, the issue at play here was that when federal Medicaid funding goes to states, states are allowed to determine who is an eligible provider under Medicaid. Now, Justice Jackson, I had read in her dissenting opinion, had said this might create concerns for the system writ large. But overall, the court had said, if Congress, if there needs to be specific provisions, that has to come from Congress. And federal administrations cannot just use these terms and conditions in federal programs to push through policies that otherwise would not fly through Congress. So Regardless, I agree with the court that it's not just singularly about an abortion issue, but it's about the relationship between the federal government and the states. And I think this is a huge win for anybody who's worried about over encroachment from DC into the states, because for decades, the federal government has used terms and conditions baked into federal funding to determine and tweak the policies in the states. And so it allows for wider berth, a greater discretion at the state level, and a little less DC control.
Yeah, so I want to read more from the Associated Press. They say the justices found that while Medicaid law allows people to choose their own provider, that does not make it a right that is enforceable in court. The court split along ideological lines. This case kind of emerged from South Carolina. And they go on to say public health care money generally cannot be used to pay for abortions, but Medicaid patients go to Planned Parenthood for other needs, in part because it can be difficult to find a doctor who takes the publicly funded insurance. What do you make of that claim? That was a Planned Parenthood claim that they made.
Well, that's interesting because I don't know the numbers off the top of my head, but for South Carolina specifically, but I know that states get on average 35% of their budget covered by federal dollars, and more than 60% of those federal funds go to Medicaid. And given these things like the provider tax loophole and other issues, and other ways of states trying to maximize Medicaid spending, maximize Medicaid enrollment, I know there are quite a few options for providers out there. And so I can't imagine that, while I don't know the ins and outs of the legal system there, I'm not a lawyer. I'd imagine that, I would imagine that Planned Parenthood is not the only shop in town, whether somebody's going for services that have nothing to do with abortions. But again, that's a really thorny legal question, and it gets back into that. What is that relationship between the federal government and the states, even if these terms and conditions are coming in with federal funding? Of course, the federal government always tries to say, well, even though these terms and conditions might come off as unconstitutional, you never had to take the money in the first place. But simply signing over, simply getting people to try and sign over these rules,
Yeah.
doesn't necessarily mean the federal government can get away with it.
Okay.
And so, I think that's an interesting question you raised, and we'll see how that plays out in the future, and if there will be further court cases to address that.
Just lastly, let's talk about entitlement reform in general, the 30,000-foot view here. Medicaid, Medicare, Social Security. I don't want to ask if they're on the chopping block, but is there an expiration date, so to speak? Are they on solid footing right now or no?
Unfortunately not. It's bad news. And then just last week, we got the Social Security and Medicare trustees reports. So we talked a little bit about Medicaid and that over ballooning the federal spending. Now Social Security and Medicare Part A are set to be unable to pay full benefits by 2033. So that's less than 10 years from now. We don't have a lot of runway left. And that timeline has really gone up, especially with that provision exempting federal workers from Social Security and Medicare getting repealed and allowing them to take it. So now the total benefits that have to be paid out are increasing, and so those promised benefits, really, it's really on shaky grounds, and that is something we cannot ignore any longer. Actually, my colleagues and I at AIER have worked on a number of solutions there, and of course, there's no silver bullet to this stuff, but we're working on a series of educational pieces on how to get out of this entitlement crisis mess that is not just coming; it's already here. The Social Security, the Wall Street Journal said that the Social Security iceberg is looming closer. Well, we've actually hit the iceberg, and we're already taking on water, unfortunately.
All right, Thomas Savidge there with the American Institute for Economic Research. I know we went a little long, but that was, I think, extremely informative for our viewers, some of whom could be on Medicare or Medicaid. Of course, some of them, I would imagine, maybe a lot of them have Social Security. Tom, good to see you.
I wish I had better news for you, Andrew.
Well, have a good weekend. Talk soon.
Thanks, Andrew.